Low back pain is the most common reason people take leave from work. We have with us Dr. Parthasarathi Srinivasan, Head of Department Orthopedics and Spine Consultant, to help us understand more on this. Hello, Doctor.
Hello.
We have patients complaining of disc problems as a cause of lower back pain. Can you throw some light on it?
It's unfortunate, but the disc seems to be blamed for most of the problems in the low back. This is of course because of a profusion of MRI scan centers all over the city, where there is a lot of scans taken and shows some mild disc abnormalities or probably just a progression of some mild disc degeneration, and the disc is blamed for this. However, back pain can be due to a multitude of causes, and most of them are not due to the disc. So we must be clear about what we are treating when we are treating low back pain. And unfortunately, when we take a patient through this line of saying that his back pain is because of a disc, he immediately goes into this zone where he refuses to do anything which involves bending or lifting weights because he fears that the problem is going to get worse. So however, I think they must understand that back pain can also arise from simple things like a muscle strain or a small injury to the back. Sometimes you can have more serious issues like a spine infection or a spine tumor, and all of these require different types of treatment. So it's important to first localize what is the cause and to then treat that particular cause.
When should we consult a doctor?
So if you have a low back pain that is persistent, that interferes with your work, or is extremely severe to start with, then it's important to get a consultation with your doctor immediately. It's important to know also if the pain is associated with fever or weight loss. These may be signs that there is something deeper or more dangerous going on, and an immediate consultation is a good thing to rule it out, or at least treat it, catch it at an early stage.
What are the things a person can avoid to prevent low back pain?
So it's a myth that stopping all activity which involves the low back, like bending forwards and lifting weights, is going to help the situation. Unless when all other major issues like spine infections, spine tumors or other anatomical bony deformities are ruled out, it's clear that the low back pains usually fall into one major area of problems, and that is poor core strength along with a poor lifestyle. Currently, most of our workforce sits at a desk with a computer in front of them for 8 to 12 hours a day, with very poor physical fitness, very low physical exercise, and this leads to a host of problems related to the low back. They usually end up getting an MRI scan and finding something wrong minorly with their disc, but unfortunately that is not the cause of their pain. The cause of their pain is the poor lifestyle. So to change that, they must realize that physical fitness is an important part of the entire thing. A couple of things that you should do is, one, have at least 5 hours of exercise per week, or that is about an hour of exercise in 5 days in a week. That is general physical exercise. It's important to involve core strengthening in these exercises at least twice in a week. Additionally, there are simple core strengthening exercises which they can learn from a physiotherapist or even from a trainer at the gym. There are more complex ones as patients get better at it. However, even the simple ones can go a long way to avoid back pain. The second thing is, if your job involves a lot of sitting and staring at a computer screen, then it's important to limit the amount of time you sit at it at one go. When you sit at a desk for more than an hour, you definitely have an opportunity to get a lot of back pain. So it's important that every hour you need to get up, stretch, defocus from the screen, and then probably come back and sit down. We must understand that the importance of exercise is downplayed so much in our society, where it's always important to study, to make a living, and the first thing that is sacrificed is exercise. But exercise is probably the simplest, easiest and most important way to a healthy lifestyle, which includes a lifestyle without back pain, a lifestyle without heart issues, diabetes and hypertension.
Exercise is the key. That's what Dr. Parthasarathi stresses. Thank you, doctor. Thank you for helping us.
You're welcome.